All right, as we begin learning systemic arteries, I want you to keep in mind a few things. One is that arteries are named very logically if you understand why they were named what they were. This either has to do with the region of the body that the artery is found in, or the organ that the artery supplies blood to. And most of these regional terms or organ terms were learned way back in A&P 1. So understanding that an artery is located in a region that you learned in A&P 1 shouldn't be too difficult. For example, you'll notice that there's a renal artery. Well, the renal refers to the kidneys. So renal artery supplies the kidney. Or, for example, ulnar and radial arteries. Well, you learned about your radius and ulna in A&P 1. So those arteries run next to those bones. If you recall from A&P 1, you learned that the upper arm is called the brachium. So the artery in the upper part of your arm is called the brachial artery. So I suggest you learn why the artery was named what it was. I also recommend you looking up in your book descriptions of the artery, as well as maybe branches off of an artery, and learn these arteries by blood flow, meaning systemic arteries all arise from the aorta. So you start at that aorta and begin to learn branches off of the aorta. So that's what we're going to do, beginning with this picture. So this picture is a little strange in that it removes all the internal organs. So some of these branches off the aorta are just kind of severed, but you kind of have to use your imagination as to where the artery might end up going. So you can see that the heart has been removed, so you have to imagine there's a heart here, and this oxygenated blood is going to enter the ascending portion of the aorta. And we already learned the first arteries off the ascending aorta. They are the coronary arteries. So you have right and left coronary arteries that branch almost immediately above the aortic valve. So blood will be ejected through that aortic valve, and the first option the blood has is to go out coronary arteries and supply the heart with its oxygenated blood. Blood will travel up the ascending aorta, and then you'll notice at the arch of the aorta, blood has three options. Option number 1 is known as the brachiocephalic trunk. It's the first branch off the arch of the aorta. It's going to divide and form the subclavian, right subclavian, and the right common carotid arteries. So notice the names of these. Brachiocephalic refers to arm and head. Subclavian refers to the fact that it's found beneath the clavicle, which is shown here. Carotid might not be one you know immediately, but carotid comes from a Greek word meaning a stupor, because if you close off the carotid arteries, someone will enter a stupor or kind of pass out, if you will, lose consciousness due to the lack of blood flow to the brain. So the brachiocephalic trunk is the first branch off the arch. It immediately divides into subclavian and common carotid. Off of the subclavian, there's a small artery, so it doesn't seem very significant, but it really is. It's called the vertebral or vertebral artery. And the reason why this artery is so significant is it travels up the neck and helps supply blood to the brain. It supplies blood to more of the posterior portions of the cerebrum, the cerebellum, the pons. So this is a very important artery, even though it doesn't look very significant on this drawing. So that was the first branch off the arch. The next branch is the left common carotid, and then the third branch is the left subclavian artery. So notice that on the right side, the carotid and subclavian share a trunk, whereas the left side, the common carotid and subclavian, come off independent from one another. So this is why there's 3 arteries, which is kind of a strange number to have, an odd number, because on the right side they share that brachiocephalic trunk. We're going to learn then what happens as these arteries travel up the neck and into the head. We're also going to learn what happens to this subclavian as it travels under the clavicle and towards the arm. And this is an example of an artery that changes its name. So the subclavian artery is no longer called the subclavian when it enters the axilla, or your armpit. So the subclavian becomes the axillary. So it's a continuation of the subclavian artery, and it travels into the armpit. And there are going to be little branches off of it that supply blood to the shoulder region and scapular muscles. And as that artery then enters the arm, it changes its name once again. So the brachial artery is a continuation of the axillary artery, but it travels into the arm. And it's going to supply blood flow to the upper arm, the humerus, the elbow joint, and then on an upcoming slide we're going to see what happens to that brachial artery as it enters the forearm. So those are the 3 possibilities off the arch, but blood doesn't all go out those 3 branches. It's going to travel then down the descending aorta, and the descending aorta is known as the thoracic aorta when it's in the chest, and then the abdominal aorta after it goes through what's known as the hiatus of the diaphragm, which is basically a hole in the diaphragm. This is a right view of the head and neck. We're going to use this picture to help see what happens specifically to those common carotids and vertebrals. So we begin at the brachiocephalic trunk, so you can imagine there would be an arch here. The aortic arch would be coming out of the heart. Here's the sternum protecting the heart. Here's a clavicle. Here's the first rib. And that brachiocephalic trunk we see divides into subclavian, right common carotid. We see the vertebral artery coming off the subclavian and traveling up the cervical vertebrae. If you recall from A&P1, cervical vertebrae have these extra 2 holes in them called transverse foramina to allow this artery to be protected as it travels up the neck. Okay, let's look at the common carotid. The word common is usually in reference to the fact that the artery is going to divide or branch into 2. And this one branches into an external carotid and an internal carotid. And there's a big difference between the 2 in that the external carotid is going to supply all the structures of the head except the brain. So we're talking the skin, connective tissues, facial muscles, bones, the meninges that surround the brain. So that external carotid supplies external structures, structures outside the cranial cavity. Whereas the internal carotid is going to supply blood to the brain, but also eventually lead to the eyeball, supply blood to the eyeball and orbital structures. But we want to remember that the internal carotid goes to the brain, the external carotid does not. And that external carotid has branches known as facial artery, maxillary artery, superficial temporal artery, and even occipital artery, this one at the back of the skull. So you'll notice all these arteries are named very logically based on where the artery is located. In the next video, we're going to focus on this picture, which can be a little scary at first, but we're going to take it slow so we know exactly what we're looking at. But this is going to help us understand how our brain gets a lot of its blood flow.